West Michigan doctors say the president's COVID diagnosis shows that the virus is still going around and people should be aware of the risk. News 8's Kyle Mitchell in studio with what they say about the state of the virus in our area.
Brian, we spoke with infectious disease doctors at three of the biggest hospital systems in West Michigan. They say while the level of hospitalized patients is manageable, people are still getting sick.
Doctors in West Michigan are still seeing COVID-19 patients.
Levels have remained relatively stable, around 50 patients in the hospital at any given time. It has trended up just a little bit over the last week, and we now have about 65 patients in the hospital, but we're not seeing a huge surge like we've seen in the past.
Dr. Russell Lampin with Spectrum Health says antivirals and vaccines that can prevent severe illness are helping keep hospitalizations low.
The number of ICU patients is significantly lower than what we've seen in previous surges. So previously, about 25 to 30% of admitted patients ended up in the intensive care unit. With the new Omicron variants, what we're seeing is only about 10%.
This morning I tested positive for COVID.
President Biden is being treated with Paxlovid, which Pfizer is working to expand production of through a $120 million investment in its Portage plant.
The biggest key is getting it quickly. These are things that have to be started within 5 days of symptom onset.
Dr. Andrew JAMESON with Trinity Health St. Mary's says they are seeing an uptick in cases.
We went for a long stretch without anyone passing away from COVID, but we're seeing some of that happening again where people are dying from COVID.
Doctors believe the BA.5 subvariant of Omicron is driving much of the recent cases.
We're having people that are getting reinfected a little bit quicker than they would otherwise as well. So some people that may have had a previous Omicron strain can get this one.
The president is vaccinated and double boosted, but doctors say the vaccines still make an impact.
A month after my second booster shot, I contracted COVID. I had a sore throat for 24 hours, no fever, no cough, no other symptoms whatsoever. So I think that second booster really is helpful.
Dr. RONALD GRIFKA with University of Michigan Health West says while COVID is still a concern, they're hopeful the pandemic can continue to be more manageable.
Between the number of people who have been vaccinated and boosted and or have also developed COVID infection, they probably have a good bit of immunity. So we're hoping not to see much of a surge this fall.
Doctors also expect an updated vaccine designed to treat the Omicron variant to make an impact when it becomes available.